Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another interview. Today, our special guest is Sue Chamberlain. She's the VP of Compliance and Education at RRS Medical. Welcome, Sue.
Thank you. Thank you very much.
Yeah, so before we dive in, we're going to be talking information blocking, 21st Century Cures Act. But before we do, tell us a little bit about yourself and RRS Medical.
Okay. Well, I am 30 plus years in the HIM field, and I'm one of the weird ones that have spent about half of my career on the hospital side, half of my career on the physician side, all of it in education. So as we discuss a few things here and there, you'll probably hear me hit things from both the physician setting and the hospital setting, since I have that perspective. I actually started with RRS as a client. So I brought in RRS to do secure transfer, secure and accurate for my physician setting, for my physician offices. And I actually had a different vendor that worked in the hospital setting, but they didn't understand the special needs on the physician side. So they did such a great job. I was happy to join them again in their compliance and education team.
Awesome. Well, I think it's so interesting. So many people talk about healthcare, and I'm like, healthcare is like 60 different markets. You have the ambulatory provider side, you have the acute care, you have long-term care, you have different regions. I mean, so I think it's great that you have multiple perspectives that you can offer, especially for our HIM audience, which will understand this really well. But let's talk about that. RRS obviously focuses on release of information. What's happened with the ROI release of information during COVID-19? What have you seen?
Well, it was interesting when everything first hit because the physician offices shut down. They stopped doing all the surgeries. All of that happened. Even the attorney's offices shut down and stopped doing a lot of that. So the request went way down. We found in a lot of hospitals, they also started pushing their staff into other areas, including sometimes the testing tents.
Wow.
So since then, now we're starting to come back, but we're also seeing that a lot of organizations are even starting to outsource more and starting to, the requests came back with a vengeance. Everybody made up for lost time. And then now we are seeing more and more where they're starting to look at outsourcing because of all the changes of staffing that have occurred because of all the COVID impact in the hospital and physician settings.
Well, and I think there must have been some massive changes since you couldn't go in to request the record, so it needs to be digital. And, do you want to mail it? And I mean, there's mail system issues as well. So like, let's figure out an electronic. Is that what you're seeing as well as some of those challenges?
Yeah, we actually have a lot more people that may have been resistant to doing things remotely and now find it works even better. It's better for the patients before COVID came into place, now especially. And AHIMA actually came out with a lot of guidelines for how to help patients get their records that go a little non-traditional than what we've done in the past, and having the patient show up and fill out an authorization and that type of thing. So by being able to provide portals and electronic access, and even sometimes taking verbal requests, has been a huge benefit. So we are seeing some changes that I don't think we'll ever see go back because it's just too much of a benefit for the patients.
Yeah, you'll enjoy this irony. Yesterday, I interviewed someone who talked about federating data to learn how to diagnose COVID risk in a patient using data from across the country, across 20 institutions. And I'm telling this to my wife. I'm like, how cool is this? They can predict respiratory things. And she looked at me and she said, that's great that they're doing that, but why can they do that? And when I go in to get my breast exam, they can't share that information with my doctor and my OBGYN without another form and request. She's like, I know I could go request access, but she's like, why do I have to do this? So I mean, it's interesting. The technology is there, but some of the business rules aren't there quite yet. And really, maybe that gets us to kind of the next topic, which is the Cures Act and the information blocking rule involved in the Cures Act, which I think has an interesting play with HIM and release of information, because in many ways it's automating patient access to that information. Now, as we're recording this, the rule literally just dropped, the final rule, and they included some more delays. So we thought for sure that everyone would have to be compliant in November. This would come out right as it needed to be compliant. But now that, they moved the ball, which is no surprise. They moved it to April 5th for the information blocking portion. The certification has some other delays as well. But so I think it's interesting that happened. But, well, one, I'd love to hear your thoughts on the delay. Is that good, bad? What does that mean? And then also, can you share what pieces will have the most impact on patients and on HAM professionals?
Yep, absolutely. So first of all, I kind of, when all of this came out and the dates were next week, I actually joked with a lot of people that I thought this was going to be like ICD-10. So those in the HIM, well, in the healthcare field, as many times as we had ICD-10 delayed,
Yeah, a lot.
We figured it would be, especially with COVID going on. There's just too many things that are impacting healthcare, and especially right now. So I wouldn't be surprised if we have some more delays. However, I just want to throw out it's very important that everybody starts working towards these goals. So a lot of this is not as much release of information in HIM, but they really need to be part of this whole process. But it's really that connection between the organization and their EHR, their electronic health record, because that's where we want to have the patients be able to get their access. So the change for the patients is hopefully, as what happened with your wife, it's going to be a whole lot easier for her to get that information sent where it needs to, for the other providers to go in and get it. It's the whole goal is to stop some of that, which has resulted in the past in duplicate tests being done, a lot additional cost, but patients not even really having the control over, some of them even having to cancel appointments and that type of thing because they couldn't get their records where they needed to be in time. So that's going to be a huge benefit for the patients and hopefully the providers that treat them. In terms of the release of information areas within HIM departments, they should actually hopefully see a decrease in the workload because they won't need to do as much release. But in my opinion, it's going to be a ways down the line because, there is a difference between the data elements that are going to be transferred and what's really in a whole record in that big picture. So there'll be, as we go further and further down the line, it's going to make it a little bit easier for release of information. But I think we're not going to see huge impacts yet, except for that whole continuity of care.
And I mean, to that point, let's dive into it a little more. Like, I know there's an important term for HIM professionals, the legal health record, which, the Cures Act doesn't require that you share the legal health record, right? So I think that's maybe something many patients won't understand is
Right.
They'll hear this, oh, no information blocking. You have to share my notes and my lab results instantly on portal or wherever it might be. That sounds great, but can you dive into that so some patients that are listening might understand, okay, that's great, and I think there's benefits to it and it should be done, but why might they still want to request their full legal health record?
Okay, absolutely. So right now, a lot of the patients may have a My Chart or something to that effect that they can get into, and they can see some information about their visit. So they can see lab tests sometimes, they might be able to see the order, they might be able to even see an after visit summary or something like that about what happened. And they can go back and do that a little ways, but it's not the full record of everything that's going on with that patient. When you go to a physician that might be associated with 2 different hospitals or 2 different organizations, now you may have two different places that you have to log in to try to get that information. So along those lines, my husband just had that. He went to his doctor, went elsewhere to get the test, and he couldn't remember how to sign on to the other my chart than what he had with the other system.
So
So the ultimate goal, if everything goes the way it's supposed to, is ideally the patients will have one place to go, and they'll be able to get in there, and hopefully it'll be an app, for example, that the patient can get into. And this, again, will be a little further down the line, but that the patient can go into and be able to access all of their information and provide it to their providers wherever they go. And they can get it quick and easy in one place. So that's the ultimate, but again, it's probably going to be just little pieces of data. So it's not going to be the whole record. So I explained to patients that a lot of them remember kind of the olden days of walking into the physician office, of which some was yesterday, where the doctor's still documenting in paper, okay? When the doctor documents in paper in a physician office, for example, they might have the med sheet in one part of the chart, and they got progress note in the other part of the chart, and they've got the ongoing chronic illnesses and what's happening in another part of the chart. And then they've got the progress note of everything that happened, where the doctor talks about what they discussed in the physical exam and all that type of thing. All of that is not going to be available at first. Those aren't going to be everything in the data set. So you still may want to get the medical record to see the whole big picture of what's going on. I'll throw out one other thing that, as a slight side note here, that I want patients to think about as we're talking to the patients here too, is that it may be important for you to look at your record, the full record, sooner than later anyway. If there's anything incorrect about it, as we're working on making the records move out to other areas easier, if there's something incorrect, so worst case example, the doctors a lot of times in the electronic records do a drop down to get a diagnosis. And if they go to drop down to get hypertension, HTN, and they accidentally go up one and do HIV instead, and now your record has in it that you're HIV positive instead of having hypertension, you want to know that before it gets shared to other providers. I often relate it to putting a drop of food coloring in a glass of water and then having to pull it back out again. Okay, so keep that in mind, that it's important as we're looking at expanding your information. You're going to be more responsible for it. It's to give you power, but it's also going to be, you're going to need to make sure it's accurate and it's secure as it goes elsewhere, because that's what your healthcare is being based on.
Yeah, one of my doctor friends described this issue perfectly. He said his problem with the EHR is it perpetuates misinformation. And now that we're sharing more, it's going to perpetuate it even more. Do you think we'll ever get to the point that the full legal health record will be shareable, or do you think there's going to always be that place for the ROI? I mean, we know the release of information is still going to have to happen for lawyers and payers and a number of those, right? But for the patient, do you think that we'll get there, or is there just too many disparate systems that you really have to access to do the full medical record?
Well, part of what interoperability is, that as part of the Cures Act, is trying to do is make it so that information sharing is better. The truth is, right now, I saw a study, the average hospital is somewhere like 16, 17, 18 different electronic health records within that hospital. Man. And you see it a lot where a certain specialty wants a certain electronic record, but does all the data always transfer over? A lot of times it doesn't. So there might be some information that's in this particular EHR that the physician in that specialty finds beneficial and might even use for your treatment, but it doesn't go into that primary electronic medical record, or what I always call the one source of truth. So we have a lot that we have to take care of with that. And I think that there's even issues with the data elements. We don't even really have that true definition of each different data element. You may have a physician in the electronic record, two physicians in the same practice that put the same information in a different data element. So I think the goal and the ideal is for the patient to be able to have access to all of it. And AHIMA, our national organization for health information management, years ago started with encouraging people to get their own personal health record and to kind of keep it, again, to make sure that they kind of have everything in one place. I would love to see us get there, for patients to be empowered, that type of thing. I would encourage that. Technology is capable, but there's so many conflicting issues with all of that technology has to catch up on. We don't even have the same platform that people program onto yet.
Yep.
So trying to get everybody to talk to each other, all these different electronic systems to talk to each other, there's a lot that needs to be done. Would that be the goal? In my opinion, yes.
It would be interesting to do a study of HEMA professionals, and say how many of you have aggregated your records. Like, this stuff. Were you able to or not? Like, that would be insightful, I think, it would say something. But I think
Yep.
there's another element of the Cures Act that I think is interesting, especially in information blocking provisions, says, okay, you need to share all this data, except these other, I forget, is it 8 or 9 exceptions, right? So there are a whole slew of exceptions, which I think make the implementation pretty challenging for a healthcare organization. So, when you look at those exceptions to the Cures Act, what should an HIM department be doing? Because it feels like they should play a role in that, because they understand exceptions better than anyone else, I think, when it comes to the records and when to share and when not to share and what to share. So what do you think HIM department should be doing to help with those exceptions?
Well, I think the HIM department needs to be at the table with a lot of them. Now, some of the exceptions are, can you do it? So the Cures Act requires it within 10 days, whereas normally most states require under HIPAA 30 days. That's not going to change. So that access component to an EHR will still be 10 days. But if a patient wants their full medical records, we're still at whatever the state is, usually around 30 days. But the HIM people come with a different, I always say that they kind of have that big picture view of things. They understand how the different elements all come into place. And some of the exceptions and how to communicate those exceptions of what's needed and what can and can't be done, I think they've got a very good control over that in understanding that. Timelines, as well as what information can and can't be released, that type of thing. So I think it's important that they work, especially with the IT department and or the EHR vendor directly, and be involved in that process. Somebody that understands what goes into the medical record and what it takes to get information out. And we have now where if the patient finds out that their information is incorrect, and through HIPAA they can fill out a request to amend.
Yep.
They may find that, yep, the wrong information was put in there, but even trying to work with IT and the EHR vendor to get that correction made is so difficult to do. It's horrible. So those are even part of this. If that information's going out and you need to make sure that it's accurate, which is part of those exceptions and that type of thing too, you need to make sure that you have a way to quickly fix it before it goes out the door.
Well, that's a great example. I look at it from another perspective too. I wonder if HIM organizations are going to get these requests. And I mean, it seems like there's almost an opportunity for the HIM professional to educate the patient on a number of aspects. I mean, you talked about some of the risk aspects for patients. Like, do you really want to share this with an application? I think there's an element there, but also, you made a request for the whole record, but is that what you really want? And I know this is something that HIM's dealt with a lot in the past, right? I can give you the whole record, but it's going to cost you $200 of copy fees, right? Or I could just give you the 3 pages you want for $1.50. That sounds better, right? Like, or whatever the numbers are. That's better than me. But so it's like now they could even say, hey, do you want them free? Maybe you just need to go to the portal. Is that a discussion? Do you think that they'll start having, and they should have, or maybe they automate it through education on the website before even requesting the record? What are you thinking is going to happen there?
Well, I think that there already is some under our current system for patients understanding. So you'll have patients saying, please email me my medical record.
Right.
And trying to explain to them the importance of encryption and what could happen, and even understanding that, I mean, I think it has been in the recent past one of the fastest growing crimes is healthcare identity theft.
Yep.
So it's very important that it's not just, you know, they may say, I don't care if somebody knows I have hypertension, but it's not just that, it's your insurance information, it's the background, that type of thing. So I think there needs to be some education about, yes, around the security, but what are portals? How do we do portals? You can have access to it and get your records 4 or 5 times. And for the most part, most people release the records to patients for free or close to it anyway, for just cost. But I think that having them understand why it's so important to keep it secure and to keep it in a way that they can get to. But also, then once they get it, what should they do about it if they don't understand what's in it?
Yeah.
So to your point, you do have a lot of patients that will call and say, what does this mean? What does that mean? And the HIM departments refer them back to the physicians. Now, if it's a hospital record, a lot of times they don't know these docs. They only saw them in the hospital and they're not sure what it means. So you still want to refer them back, if they have one, to their primary care physician to discuss it. But there is a lot of questions that come out, and the patients may be given more and more information that they don't understand. And so that's going to increase with some of this. And I mean, my funny one is you do have patients like that, the doctor wrote obesity, and they're very unhappy about that and want the doctor to take it out. And, so, you know, it's that kind of thing too, to help the patients understand there's one thing to be wrong and there's another thing of not liking the information that's in there. So when we say correcting your record, it's not necessarily taking out things that you just don't want in there, because it's important for your full medical care.
Yeah, I mean, I know that feeling. When it said morbidly obese, I didn't like that clinical evaluation of my eating habits. So I understand.
Exactly. And if you take it off, it doesn't, it's not there anymore. You're not obese anymore if we take it out of the record.
Yeah, there's some clinical issues there, but that's a different topic for another day. Yeah, I think of my friend CT Lin, who's one of the best data sharers out there. He's, you know, advocate for open notes and pushing the results to patients quickly and all that. And he wrote something interesting and basically said, and this is my own Cliff Notes version, he's like, it's coming. Strap up and get ready, whether you like it or whether you don't, it's coming. And you know, it did get pushed to April 5th, so there's a little more time to figure this out and make sure we understand it, but it's definitely coming, and I appreciate you offering these insights and perspectives. For those people that want more information about RRS Medical, where can they go to learn more?
Well, a couple different places. One is they can go to rrsmedical.com, and on our website you can find more about our services, where really our goals are to help our clients support the patients in their healthcare journey through technology and knowledge, but also kindness. So that's one of the things I just want to get out there, because that's part of the reason why I also came to the organization. And because we value education, you will find a lot of materials out there as well that can help, including a webinar coming up in December that we're going to talk about the Cures Act some more.
Nice.
The other thing I strongly recommend is that you follow RRS Medical on LinkedIn, because then you will get all the notifications of future educational resources and that type of thing that we put out there.
Awesome. Well, the kindness element resonates with us. We call Healthcare IT Today the most friendly media organization in health IT. So we're there with you. And thanks so much, Sue, for sharing. And thanks everyone for watching. If you want to find more great health IT and HIM content like this, be sure to check it out at healthcareittoday.com. Thanks, Sue.
Thank you.